This is what it's like when you have chronic disease. The questions are there with you every single day. What am I going to be like today? What's it going to feel like? Am I going to be able to make it to that party? Will I be able to play with my child? Will I be able to have the energy to eat? When we're talking about chronic fatigue syndrome, I feel like this condition is just so often misunderstood, misdiagnosed, and mistreated. And I really want to talk about why is that and what is it that we can do so that we can stop this unnecessary suffering that is going on with so many people all around the world. I really think to effectively diagnose and treat chronic fatigue syndrome, it demands a new way of thinking on both the part of the physician and the patient. We need to jump into a new way of being with chronic disease. And this is going to take shifting and changing the mindset on everybody's part for this to work out as well as it can. I really believe at this time we're all frankly at increased risk for chronic fatigue syndrome. This pandemic is causing so much stress in all of our beings and all of our bodies. It's making us feel grief. We feel fear, we feel anxiety. These can all be triggers for chronic fatigue syndrome, and we're all at increased risk for coming down with this condition. I am concerned that we're going to have another epidemic of chronic fatigue syndrome post-COVID pandemic because of the stress that's involved. This is a time that we need to be more aware than ever of this condition so that we can help as many people as possible. And we need to be willing of how we approach this illness, be willing to change how we approach this illness. And I really want to do this because I want to save more people from what I call the land of the walking dead. It's like you're zombies, you're either like that all the time or part of the time, and it is miserable to be walking around half dead. Life is for living. We should be living our utmost fullest that we possibly can in this lifetime. And the world needs us to be our brightest and shiniest at this time. We need to be doing as much work as we can to shift the world into a better place. And the healthier we are, the more we're able to do that. For those who suffer from chronic fatigue syndrome and myalgic encephalitis and fibromyalgia, this feeling of being in the dark and feeling unknown about their health, wondering if they're going to make it, if their family's going to make it, will they be under financial distress, is not new. It may be completely compounded by the pandemic, but it's not a new thing for them. This is what they live with all the time. This disease can affect us in so many different ways, and I'll talk about that in a minute. I've been really fortunate in my profession. I'm a board-certified naturopathic doctor. I've been practicing medicine for over 20 years. I've been blessed to be a clinical faculty at the best naturopathic university in the United States. It's the oldest and the best, helping to graduate really fine naturopathic physicians. I've had my own private practice. I'm a parent, and I am just so excited to be able to be with you here today and share with you my knowledge. I've worked with the sickest of the sick with complex illnesses. And chronic fatigue syndrome is very near and dear to my heart because it has taken me down twice. The first time I was partway through medical school, and the second time was 17 years later. Each were a bit different, but what was common for each was that look in each of my kids' eyes when they would look at me and say, "Hey, Mom, can you play with me? Can you help me? Can you be with me?" And I'd have to look at them and say, "I'm sorry, honey, Mommy's tired. I need to go lie down. I can't play right now." And the look of disappointment on their face brings tears to my eyes even now as I talk about it. We talk about the statistics for these diseases. We talk about the impact they have on us, on the people who are experiencing it. But what about the impact on their families? And I want to reverse this as well. What is the impact on their families when they can experience vitality again? When we can get them so that they're feeling their energy back, when they can say yes to that child. This is what I want for everybody who's suffering. And I believe that there's always room for us to improve our health. No matter where we are, there's always a space that we can grow and we can change. Are there miracle cures? No. But there are strategies that we can use where we can use step by step and improve our health every single day. How is it that we fail as physicians, and how is it that we fail as patients whenever we're talking about doing something new and trying to improve ourselves? As docs, it's really, really easy to fail because we think we already know it, or we know better. If we hear something that goes against our original training, so whatever your original training is, if it was functional medicine or conventional medicine or naturopathic medicine or nursing, whatever that first downlay was, that's deep. That's deep learning, deep training, deep philosophy. And if you hear something that goes against that or is different from that, doesn't quite fit into those boxes, it's easy for us to kind of be like, I'm not interested in that, and shut it out. And then, of course, there's just the curse of being the expert, right? I mean, once you've been out practicing for a long time, you've studied a lot, it's easy to think, oh, I don't need to learn anything new, or I already know all of that already. There's always something for us to learn, always, always. There's always a little piece. The other way that doctors fail is they get burnt out. And they stop, and they get burnt out because they're not paying attention to themselves. They're not listening to their own heart and their own mind about what they should be doing with their energy. And when we get burnt out, it's really easy to do the other thing doctors do to fail, which is to stop listening to their patients. The way that we fail as patients, and this may sound harsh, but I can say this because I've been there myself. The way we fail as patients is we get stuck in our victim and our anger. We feel extremely righteous in this position, and we frankly get energized from being in this position. And I can say this because I lived here. I know this one. And I know that being in my victim blocked me from being able to heal completely. It was not until I was willing to give up that little armor and put it down and have compassion for myself and everybody else who was in my life that I was able to move forward with complete healing. I think that sort of related to this is that as patients, sometimes we give up. You know, we figure this is all I get. This is as good as it's going to be. Now, this is a tricky one because there is a beautiful place that we can be where we can be at peace with what is. And there is a very deep healing that can come when we really are at peace with what is. And if it truly is peace at what is, that's okay. But if it's just a harumph, oh, life is terrible and this is all I get, that's you and your victim giving up. I say, you know, there's always something else that you can search for and look for inside or outside of yourself to help you on your way in your journey of healing. Something that we all do, whether you're a physician or a patient or something in between, is we resist change. We resist it. We resist change that's even good for us. It can be great for us. We know it's good for us. We want it. We want to be on that different diet. We want to be working out. We want to be using the essential oils or the herbs that calm us down. We want to be doing our deep breathing exercises, but we resist it. And it's such an interesting thing because this very resistance is part of the brain trying to keep us in our same spot. It's trying to stay safe. It says, well, you know, this box isn't very comfortable, but it's the box I know. So I'm going to stay here and I'm not going to try to get out of this box. But honestly, when you're experiencing the resistance, whenever I feel the resistance, and if you're feeling resistance, often that is just the brink of change. Some of you know what I'm talking about. That's just like that moment where you know that there's something really good on the other side. I know that there are times when I meditate every day, and most of the time I want to meditate because I've been doing it for so long, but there are some days I just don't want to meditate. I just want to go start my day. I don't want to get started sitting. And every single time, the more resistant I am to sitting in meditation, the more juicy, good stuff happens in that meditation. It's almost like my brain knew that there was just some really great shifts that were open for me that morning, and it was resisting to that. So I say, if you're feeling the resistance, dive in and keep pushing through. Or if something I say rubs you the wrong way, I'm cool to hear about it. I'd love to have the conversation, and check where that's coming from inside of you, because maybe there's a voice inside of you that just, maybe it's ready to change and it's just throwing up a little hissy fit first for a second. And I realized I was walking with one of my doctor friends up on Mount Tabor, and I said, my patients are getting better than me. And I feel like I'd hit this thing that I call a glass ceiling. And I want to share this concept to you because if you are struggling with your energy, I want to make sure that you're aware of your glass ceiling and that you choose to break through it. My glass ceiling for me was, I was in this little box where I felt like I was better, but I wasn't as good as I knew I could get. And I knew that there was a higher level that was available to me. And previously, I would have been happy with the life that I had. I could go to work, I had to take a nap every afternoon, I had to eat certain foods, I had a very scheduled thing, but I could function. Because I'd been so much better before, I wanted that again. I wanted to be able to do whatever I wanted to and not be afraid of crashing. That's what I wanted. I wanted big wave surfing again. I wasn't willing to give up to this other piece. And so I knew that I had to go in further to find another level for myself for healing. And that's where I found the fifth cause of chronic fatigue syndrome. And that's what allowed me to be able to move to a place where I still bump up what I call against my glass ceiling, where I think, oh, that's going to be too much for me. And then I realize I can do it. And then I find another glass ceiling and I go, oh, I can do that too. And my life is just getting bigger and fuller, even though I still at times get triggered and feel like I have to treat aspects of my chronic fatigue syndrome. I know that my life is just getting bigger and fuller and bigger and fuller every single day. And that is what I want for you. It's the statistics around chronic fatigue syndrome are crazy. And honestly, I don't think they're that accurate. It's estimated that at least 2.5 million people in the United States suffer from unrelenting fatigue, muscle pain, brain fog. And that doesn't even count the rest of the world. And this condition knows no boundaries. It used to be called the yuppie flu. They thought it was just kind of white, affluent people that had it. That is so not true. It hits every single demographic, every single ethnic group. This is a worldwide global condition. It's a problem. And it is a complex condition that affects many organs in the body and can affect the brain and the digestive system. And it can make people go from either feeling just tired and draggy, like I was at different parts of my time, or flat out in bed where they need somebody to feed them. It can be a very, very, very serious condition. This leaves so many people unable to work full-time or at all. And this condition affects women more than men. The studies are a little bit skewed in different ways, but at least 4 times more likely to happen in women than men. And it's likely due to how estrogen affects the pain receptors and alters and interacts with their cortisol, with a stress response. But I have to say, it's possible that men are also underdiagnosed because culturally it's kind of manly. It's not manly to talk about being tired. I read an article about somebody who mentioned that the other day, and I thought, that's fair. That's fair. I got to mention that. It leads to massive financial loss. Again, completely underestimated numbers. I'm not even going to try to pretend to have a number for you. There are numbers out there. But I really think it's underestimated because if you think about this, first of all, if they are 4 times more likely to be women, how do we know what those women might have done if they'd had more energy? If a woman is too tired to work, she might just stay home and take care of the house and be a homemaker, or stay home and take care of the kids, it's great. It's a great choice if that's your choice. But if you're doing it because you're tired, what else was possible for that person if they had gone to work, if they had found a satisfying job, or if they had gone to school to get a higher level degree? What opportunity was lost there, and what financial impact does that have? And then there are the things that we can't even, calculate. There's what joy is lost from the people that suffer from fatigue. And what is that impact on our kids, our partners, and our families? And what do we lose as a community and as a world where we don't have everybody who can contribute at their very best all the time? What are we losing out on? I really feel that this is such a mission. It's so important that we all be able to raise our level of health at this time more than ever. Why is chronic fatigue syndrome so misunderstood, misdiagnosed, and mistreated? I've been really thinking about this for a long time because it's been in my life for so long, and I've worked with so many patients with this, and I've heard stories of patients who come to me and they've been to so many doctors who have said, I'm sorry, we just don't have any answers for you, or you just need to drink some more coffee. Patients that are sent to the psych ward instead of given any effective treatments, they're given antidepressants or hormones. And it's just like, why? Why is there not a better understanding? And I kind of get it. I understand why.